Good evening, everyone. I am Dr. Brendan Lagranard, Head of Alumni Affairs here at St. George's University, and I'm extremely proud to be here this evening. As you can guess, I'm definitely not a woman physician, but it is my distinct pleasure to see our panel of successful women physicians who play an integral role within our Alumni Association. And this year marks a special year for the home of St. George's University, Grenada, in that Grenada celebrates 50 years of independence. And I am so proud to see so many of our Grenadian physicians featured on this panel. So on behalf of our Alumni Association and our Alumni Affairs, congratulations, and let's keep the strength and power of our women in medicine alive, celebrated from 1849 to 2024 and beyond. Congratulations to our women in medicine and success on this panel. Thank you.
Good evening. My name is Dr. Kecia Lowe, and I am pleased to welcome you all, women physicians, residents, medical students, and our male colleagues to the 4th commemoration of National Women's Physicians Day. Today, February 3rd, is Dr. Elizabeth Blackwell's birthday. She, after much hardship, became the first female physician in the United States in 1849. Since 2016, this day has been observed to honor the perseverance and eventual success of this trailblazer who opened the door for all future women physicians. Just 15 years later, in 1864, Dr. Rebecca Lee Crumpler became the first African-American woman physician. Dr. Crumpler was also the first Black person to publish a medical book in the United States. This day also honors the pioneering achievements and ongoing contributions of female physicians in healthcare. Did you know that in 2017, a Harvard study showed that Medicare patients cared for by women doctors have better health outcomes, significantly lower mortality, and readmissions compared to those cared for by male doctors? In the USA today, male doctors still predominate, but that is changing gradually. In 2017, an Athena Health survey of 18,000 doctors revealed that more than 60% of physicians under the age of 35 are female. And in 2022, 53.8% of students enrolled in medical school were women. This day also strives to bring improvements to the workplace for the growing number of women doctors entering the field of medicine. According to a physician compensation report in 2023, there was a 26% gender pay gap, even when salaries were controlled by specialty, location, and years of experience, with men earning nearly $110,000 more annually than their female counterparts. It is also reported that approximately 30% of female physicians have faced discrimination for either being pregnant or needing to breastfeed or pump for their babies. These factors contribute to the increased rate of burnout experienced by female physicians compared to their male counterparts. As a double alumna of SGU Medical School class of 1992 and School of Public Health class of 2012, I am proud to be here celebrating this special occasion with you this evening. After graduating from St. Joseph's Convent, St. George's, and Smith College, I decided to pursue a career in medicine because I realized our medical system was sorely lacking in delivering quality healthcare. At my SGU graduation, I was the recipient of the Geoffrey H. Bourne Award for Outstanding Integrity and Motivation. I decided to do a combined internal medicine and pediatrics residency at St. Joseph's Hospital and Medical Center in Paterson, New Jersey, because in my opinion, having expertise in 2 primary care fields is very practical in a community setting. When I returned home, I set up my clinical practice. I worked at the General Hospital as a consultant in internal medicine, and I started teaching part-time at SGU in the Department of Clinical Skills. As a practicing female physician in Grenada, I feel that I am making a valuable contribution to my society by providing comprehensive, up-to-date, and holistic healthcare to my patients and their families. I focus on listening to my patients, educating, and encouraging them to make healthy lifestyle choices. I also prioritize meeting my CME, my continuing medical education requirements, to maintain my double board certifications in internal medicine and pediatrics, because I owe it to myself and my patients to keep abreast of the latest developments in the ever-changing field of medicine. I am pleased to introduce our moderator, Dr. Frances McGill, class of '81, former alumni officer and now Professor Emeritus, Department of Clinical Skills and Obstetrics. On a personal note, Dr. McGill played a crucial role in my journey because she interviewed me for my admission to SGU. I am so grateful that she saw in me potential and promise. Dr. McGill, the floor is all yours. Thank you.
Thank you, Dr. Kecia Lowe. You're very welcome. So a little joke, when I returned to Grenada, Kecia Lowe said to me, "Do you remember me?" And I said, "Well, I know you now." And she said, I was the person who you interviewed. And then thinking back, a lot of the alumni in the early days were on the admissions committee, and we went to Coney Island Hospital on weekends. And yes, I do remember this lovely young woman from Smith College who said she wanted to go to Grenada and she wanted to care for the patients, and she did. I went to St. George's University because I was a nurse first and nobody wanted old nurses. So 47 years ago, just 3 years after Grenadian independence, the charter class in the School of Medicine came to Grenada, and many of them also were people who had done something in health fields. I was in the second class, and following graduation from St. George's, I did my internship in medicine in a small Harvard program. And then I did my residency at Women and Infants Hospital in Providence, Rhode Island, which is the Brown University program. Following that, I did academic medicine in New York City. Then I went to Grenada in 2008, where I worked 15 years and had a wonderful international life, teaching and taking care of patients in the clinic. And now I have moved into the emeritus, which is not really retired status. So I want to welcome everybody this evening. The panel today is a little different. In years past, we focused on a lot of younger physicians. Now we're giving you the opportunity to look at mid-career physicians and some senior physicians to try and think of where you might like to be 10 to 20 years from now, because time goes very, very fast. So I am going to ask each person to introduce themselves, and we're going to start with Dr. Myanna Charles, who I've had a great opportunity of working closely with.
Thank you, Dr. McGill, and hello, everyone. I am Dr. Myanna Charles, and it's truly an honor to be here with you. I graduated from St. George's University with my MD in 2016, followed by an MPH in 2021 and a postgrad certificate in medical education in 2022. In my current role, I serve as a lecturer in the Department of Clinical Skills at St. George's University, where I had the honor of being mentored by Dr. McGill. Prior to joining my SGU family, I had the privilege of contributing to public health as the acting senior medical officer within the Ministry of Health and Social Security in Grenada. Additionally, I worked as a clinician in the field of internal medicine for 3 years. I am excited to share my experiences on this esteemed panel together with some of my colleagues here tonight. Thank you for having me, and I look forward to our discussion.
Thank you, Dr. Charles. Our next person to be introduced is Dr. Shania Flagg.
Hi, good evening, everyone. And thank you so much, Dr. McGill, for extending the invitation for all of us as esteemed colleagues to be able to present and share our experiences on this forum. Again, as you mentioned, I'm Shania Flagg. I attended St. George's University from 2009 to 2013. I was actually a global scholar. So I did my first year for the Keith B. Taylor Global Scholars Program in Newcastle upon Tyne, and the second year in Grenada, and my third and fourth year, mostly in the United States. But I also wanted to honor my commitment for the Global Scholars Program in practicing medicine in an underserved or low-income country, at least some portion of my career. So the former chair of pathology, Dr. Brewster Moth, he opened the opportunity for me and another one of my colleagues to do our surgical rotation in India. So I was fortunate enough to do that, spend a month and live a month in the southern part of India and do surgery there. So after I graduated, took a very interesting turn in completing my residency in family medicine at St. Joseph's Hospital at SUNY Upstate in Syracuse, New York. And afterwards, I took a gap year and did travel medicine and urgent care, and just trying to really figure out what I wanted to do. But I really, really wanted to hone in on women's health. So I applied and got accepted into a fellowship at UCSF Fresno. UCSF is University of California, San Francisco in Fresno, California, for a surgery fellowship in obstetrics/maternal child health. I completed that in the fall of 2018. And I was also junior faculty, and then I came on briefly as a clinical faculty and taught the family medicine residents as well. In that time, I also did a lot of traveling, and I tried to give back, and I became very tied to Grenada, and I would come back, and there were a couple of times I actually would visit even Dr. Lowe, and she would say, you know, what are you, crazy? You're coming back here to Grenada, I'm supposed to be on vacation and you want to work. And I would, you know, follow her around, and which I really, really appreciate, because it didn't feel like work at all. And I was able to do medical missions in Ghana during my family medicine residency, as well as in Haiti. I did that as well, and I helped spearhead the global health track for my family medicine residency program. So I do love a lot of international work. It helps sharpen my medical acumen and being able to deliver healthcare services in a resource-limited environment. And it also helps me to feel really good about what I'm doing and giving back to those that are less fortunate. I now currently, I changed paths significantly for actually better work-life balance, which we'll talk about later. But now I am actually the regional physician and surgeon for the California Correctional Healthcare System, or CCHCS, in Central California. I, along with two of my other colleagues, help provide clinical and administrative medical support to up to 8 different correctional institutions. And one of my roles, briefly for about 5 months, was the acting chief medical executive for the California Women's Facility, which is the largest women's prison in the world, which was very challenging, but it was extremely rewarding as well. And now I stepped back into my as a regional physician and surgeon and saw some patients today, which was great. Thank you all for having me.
Thank you, Dr. Flagg. And now we're going to ask Dr. Debbie Coy to introduce herself, please.
Yes, hi. Thank you for including me tonight. I'm honored to be a part of this panel. I'm Debbie Coy. I'm a pediatrician in West Orange, New Jersey. I own my practice for the past 28 years and started from the beginning. And now I'm proud to say I have 4 providers in this practice. I graduated from St. George's in 1988. I was what they called the invasion class. So I entered in 83 and then spent a variety of my time in different locations, Barbados, New York, but ultimately graduated in 1988. I did my residency in pediatrics in New Jersey at University Hospital, UMDNJ, and then went on to join a practice for several years and decided my goal was to ultimately own my own practice and make a difference. So I started my practice in 1995 and have been doing so since then. One of the greatest honors of my practice is it ages me a little bit, but I'm proud to say I'm now in the 2nd generation of patients. So that to me is one of the greatest honors and successes of the practice, when these parents now bring their children to me. And I've been active with the Alumni Association over the years past. I was on the executive board. We actually started the CMEs many years ago, and now I'm just a proud member who loves to go to the CMEs. And that's it. So thank you for including me tonight.
Thank you, Dr. Coy. And I'll ask Dr. Sasha Lake to introduce herself, please.
Hello, everyone. Good evening. Thank you, Dr. McGill, for the invitation to be here and partake on this panel. I am Dr. Sasha Lake, and I am from the class of 2018. My path is a little bit different from everyone because I am in the field of medical education. And so after graduating from St. George's University, I returned back to join the teaching faculty workforce, where I was taking on the opinions of Dr. McGill, and she served as one of my greatest mentors and sponsors that has allowed me to have many administrative positions here at SGU. I am an assistant professor across 2 departments, in the Department of Pathology as well as in the Department of Anatomy. Also in the Department of Pathology, I do have an administrative role where I serve as the deputy chair for the department. In addition to that, I am also the Assistant Dean of Academic Affairs. Outside of my work-related duties, I have the privilege and honor to serve as the lead faculty advisor for the Women in Medicine Student Organization, better known as WIM. And it's always a pleasure to inspire the minds of upcoming women's physicians. Thank you for being here. It's an honor.
Thank you, Dr. Lake. And our last participant is Dr. Maria Lenaz.
Good evening. Thank you very much, Dr. McGill, for this wonderful opportunity and to be part of this esteemed panel. My name is Maria Lenaz, Dr. Maria Lenaz. I am part of the class of 1982. I trained in obstetrics and gynecology at the Hartford Hospital, the University of Connecticut. My professional life began in academic medicine. I was primarily doing clinical medicine, medical education, and administration. And with time, I developed a very strong interest in administrative medicine and actually ultimately transitioned into administrative medicine. I completed a fellowship in medical informatics and a second master's degree in medical management. And I have certification in Six Sigma, in patient safety, in medical management, and I'm a CPE, which is a certified physician executive. I'm a fellow of the American College of Obstetricians and Gynecologists and a fellow of the American Association of Physician Leadership, formerly the American College of Physician Executives. And again, it's an honor to be here this evening. Thank you all.
Thank you very much, Maria. So as you can see, we've got a very diverse panel, and I'm going to start with the first question, and that is, what makes a great leader? And I'm going to ask Dr. Myanna to please answer that.
Thank you, Dr. McGill. And this is a great question. To me, as a woman in medicine, a great leader embodies compassion, resilience, and the ability to inspire, just to mention a few qualities. Compassion is critical. A great leader, and this is very important, understands the human side of medicine, recognizing the vulnerabilities of both patients and colleagues. And this is why I always say to my mentees, let your compassion be your compass. Resilience is another key quality. In the dynamic field of medicine, obstacles and new challenges are inevitable. For me, COVID-19 was the ultimate of these challenges, and I had to be resilient while motivating my team and my country to persevere in the face of unprecedented challenges. And lastly, the ability to inspire through mentorship. A leader who invests time in mentoring and developing the next generation of healthcare professionals contributes to the sustainability and growth of the medical field. And this is one thing Dr. McGill, on this panel did for me. I was one of her mentors, and, that was an amazing experience, and it molded me into the person I am today. And if Dr. McGill will allow me, in addition to those qualities, a great leader should always be willing to listen and to learn, since learning is a continuous process. Thank you.
Thank you, Dr. Charles. We're going to move to the most important question on all of our panels in the past, and that is, how do you balance career, family, wellness, perhaps a hobby if you have time? And I'm going to ask Dr. Shania Flagg to address this question, please.
Thank you very much. And I think it is a very important question, and it's very valuable it's very important to have work-life balance and really understand like what that means. And it really means taking stock in what you value. What are your personal values? For me, my values were family. My values were medicine. My values are women, reproductive rights, babies, animals, and taking time for myself and reflecting. Once I really internalized what those values were for myself, it compelled me. And I also encourage all of you to allow it to compel you to make sure that you make very safe choices for yourself in terms of what you want to do in order to preserve your mental, your emotional, your spiritual, and your physical health. All of those components are very important. When we train in medicine, we primarily are focused on the physical well-being. And honestly, even learning from Dr. Lowe, from going to her institute many a times and just seeing how does she do this as a student and as a resident, and realizing that value and having that, pushing that at the forefront. Mastering compartmentalization is extremely important, and maintaining boundaries. In my current role in corrections, I'm forced to, or I'm compelled to maintain boundaries in terms of what I share with patients and vice versa. And I had a position, a few years ago where I was on call for obstetrics for 72 hours. And that's a lot. That's really excessive. And Dr. McGill, we had talked about this the other day. And looking back, OBs usually don't take 72-hour calls. And here it was, I was taking 72-hour OB call as a fellowship trained FM practitioner. And I remember in the middle of the night at 3 a.m., I'm delivering this woman's baby and caring for this baby. And I had a very young son who was also an infant. And it just struck me, I'm taking care of somebody else's kid, and I'm not even caring for my own young. So that forced me to take stock. And I think that is very important. But having those boundaries, maintaining your values, and really sticking to that and compartmentalizing is really key.
Thank you, Shania. Lovely to see you and know that you have your baby and time. Maria Lenaz, you talked to us a lot about your career. What I'd like you to do very briefly is tell us how you made the change from the clinical medicine into administration, and then to briefly answer your question. And your question is, what advice do you have for women looking for alternative careers in medicine? Dr. Lenaz.
Thank you, Dr. McGill. I think I can answer the first part by answering the second. I think that's kind of how I'd like to at least try to approach it. I would say the most important advice I could give is to really understand why you are looking for an alternative to 100% clinical practice. I think you need to learn about the options that you might be interested in pursuing, whether it is administrative medicine, of which there are a number of arenas in that field, or research, pharmaceutical, government industry. You must have a clinical competency for a number of years before you will be considered seriously, not only to get the opportunity, but also to perform competently and effectively and have credibility with your peers, which is the most critical part. You need to recognize that these, and I'll put them in quotes, non-traditional careers or pathways also require a great amount of effort. There's a lot of sacrifice that goes into this, a lot of substantial time commitment and hard work. You will need to maintain your clinical competence throughout this time frame, but you also must learn the language of a new discipline. So you're going to have to learn a new language as well. And you're also going to be presented with a steep learning curve, just as you were in clinical medicine. You may even need to consider pursuing another degree. One of the other issues with this is I think you need to get some hands-on experience to develop a skill set by volunteering for additional assignments within your organization or hospital, and network with individuals who are in the alternative careers that you're interested in pursuing. Ask if they would be willing to have a conversation with you. Ask them how they got involved in the field, what particular successes and failures they've had. Do they feel that they needed to pursue additional education? And if so, how has that benefited them? I would also see about attending a conference in the field to gauge your interest in that particular field. Also, if there are journals that are specific to that field, I would suggest subscribing to the journals. And also, if there is a specialty society, also considering joining the specialty society.
Thank you, Maria. Is
You're
there
welcome.
anything specific that you would like to talk to about mentorship as you made that transition?
Yes, I would. Thank you, Dr. Yes. Yes, that was my next question, I believe. The value of a mentor. I will tell you personally, I'm going to tell you what I think about mentors, and then I will share something about my mentor with you. I believe that having a mentor is very important to grow as a leader. Along with developing leadership skills, I think having a mentor to advise and guide you can increase your confidence and help you with problem-solving skills. Mentorship can be a mutually beneficial professional relationship for professional development. There was an article in the Harvard Business Review in 2020, and I'd like to cite what it said. Even though 76% of working professionals believe that a mentor is important to growth, more than 54% do not have such a relationship. I think the steps to take to build that type of relationship, I think you initially need to determine your goals and the needs, why you want a mentor. You need to evaluate what type of mentor you're interested in and think through how the mentor can help you. How do you go about finding one? I think you need to search through your network. You need to go through professional connections, volunteer events, social gatherings, conferences for potential mentor candidates. And also there are mentorship platforms, either with specialty societies or with your school alumni that have mentorship programs. You need to avail yourself of those. I would ask for a conversation initially. I want to learn more about the individual and what their work is to see if there is alignment to ask for mentorship. If so, I would ask for a meeting, something low-key, coffee, tea. I'd come prepared. I would determine if this person is the right mentor for me. And then I would ask, are they open to mentorship? And I would start it very simply in that I would have a meeting, I would have an agenda set up, trying to identify what my goals are and what I feel the mentor could help me with. And set up a schedule, perhaps monthly you will meet with the mentor. Always go over what you did before and continue with your questions. And I think you need to have accountability as well as be prepared every time you come to the meeting with the mentor. It can be done telephonically or in person, depending on where the mentor is that meets your needs. And I always would say, continue when you finish a meeting, follow up with a thank you note. I think you need to understand that a mentor is taking his or her time. And we all know that as you teach, you learn. So it's a valuable relationship for both. But a mentor takes his or her time. You need to thank them, not only for what you're learning from them, but respectful of their time as well.
Thank you, Maria. Next question. You've described a lot of success in your career. It's how do you define success for our younger people who are looking at this?
All right, thank you for extending that question to me, Dr. McGill. You know, as a medical educator, I get to see students just as they are beginning. And for them, success is more or less defined along the lines of making the grades, putting on their white coat, and so forth. And they're coming to that realization of their potential and fulfilling their purpose and ambition as aspiring doctors. And I see here on the panel today that there are many professional women who, in their introductions, give us a snippet as to how fulfilling their careers has been in clinical medicine and beyond. And so when I think about students and when I think about the magnificent women who are here on this panel, a quote comes to mind. And that quote is by Maya Angelou. And it reads, "Success is liking yourself, liking what you do, and liking how you do it." But I like to modify that just a little bit and think about it as success is loving yourself, loving what you do, and loving how you do it. And so for me, success is not only measured on external factors, it's more internal factors. such as happiness, your fulfillment, your sense of purpose. And it was mentioned before, but I do believe that keeping your activities that you are doing aligned with your values helps you to achieve success. I'm also someone who lives by the theory of having many different plants and pouring into them, fertilizing, watering so that they grow. And I think that it is very important for upcoming physicians to keep in mind that you also have to be well-rounded. Get involved in other activities, do a public health degree, do something in business administration, health policy, because it does add to your success as a future physician. And so those are the words that I would like to add on being a successful individual.
Thank you very much, Dr. Lake. And now, Dr. Coy, you have been extremely successful in having a private practice, particularly in this day when people are moving out of that. Can you tell me what contributed to your success and also what were the challenges you faced?
Thank you, Fran. Well, for me, I lived by 3 words, and I still do to this day: confidence, perseverance, and determination. Not only have I lived by these words, I instill this in my own children. I instill it in patients since I'm a pediatrician and I'm always trying to give words of encouragement to them. These 3 little words I feel were a great success for my 28 years in private practice. I feel for each of us, we have to be, as someone said, we have to be passionate about what we do. Mm-hmm. We have to love what we do, because if we don't, you can't be successful because you're not happy. I always find that you need, from a young or starting point, we have to set our goals. You set our goals and we don't stop until we achieve those goals. You have to be confident. You have to be confident that you could do anything you set your mind to do. You have to be determined. You have to say, I am going to do this, especially as women. I'm not going to let anything come in the way. And you have to persevere. No matter what obstacles are thrown your way, whatever alternate pathways you must take, you will achieve your final goal if you want that. For me, my goal was to never let a day go by without making a difference in someone's life. As a physician, as a person, whether it be my patients, whether it be their parents, their siblings, as a leader and owner of my practice, whether it was with my peers and my coworkers, I always felt that you have to make a difference. Like I said earlier, the best thing for me is watching my 2 generations of patients grow. I feel as challenges as a woman and as a physician, we've touched upon that. It's definitely the work-life balance. You have to carve out time for your family, for your personal being, but yet for work. When I walk into a room, I close that door, and to those patients, nothing else in my life is important. They have my undivided attention. And while I'm at work, I give my 100%. But I do carve out time for my family, because I don't ever want my children, my husband, to feel like they're second fiddle to my career. It's a balance. I was class mother for every one of my children. I was a basketball coach for my daughter. I did trips to tournaments for soccer. I never let my children feel that work was first and they were second. And I feel as a mother, I'm very proud of this, because I've obviously done a good job, because now I have 3 daughters that are following in the footsteps of St. George's. Wow. One is graduating veterinary this week. One is in her 3rd semester in medical. And my youngest has just been accepted today and will be starting in August. Mm-hmm. So I think as a woman, I've succeeded in showing my girls and others the passion and way to go. And balancing, you can do it. You can do anything you want to do. And that's my words to leave with all of the women listening. You don't have to sacrifice. It is able to do both, and to do both very successfully. Thank you.
Congratulations on your daughters, Debbie. That's wonderful. You've been a great role model. And Debbie has brought those children to Grenada to our conferences, and one of them is coming up in March on the 6th. So please look at the alumni website, and maybe you can come down and bring your family. And Debbie brought those children since they were little with all of her family. So thank you very much. And now I'm going to turn back to Shania, who will do the last question. And Shania, that is, do you have a role model, and how did that person inspire you?
Yes, so I actually have several role models. And I feel that when you're in this particular field where it was, and still is in many ways, a male-dominated profession, that it's hard to only have one role model. I would like to say the first role model is Dr. Jennifer Parker Porter. She's an otolaryngologist and plastic surgeon in suburban Washington, D.C. She was my role model in inspiring me and motivating me to actively pursue my career in medicine, and not just be passive about it. Secondly, actually, is Dr. McGill. You were an extreme role model for me back in 2010 when I was on the island and an active participant in Women in Medicine and WIM. And I really appreciate that and all of your sage advice and pursuing not just a career, but having family and balance and travel and taking passion in what I do. And lastly, probably my strongest and most emotional role model, trying to, is my father, William Flagg. He instilled in me not a can-do attitude, but will do. Persistence, dedication, and giving back to those who are less fortunate. He also taught me 3 things. And there are things that, one of them, we kind of talk about expressing gratitude, which is really important, but also practicing compassion. And I saw him do that a lot and making a lot of sacrifices. And also setting your intention, doing everything with intention, I think is very key as well. And those are my role models. My father's the strongest. Thank you.
And we're very sorry Shania's father just passed on to our next life, and we hope that she'll feel his spirit a lot. And her son looks just like him, which is wonderful. I want to thank everybody very much for participating in the panel. I particularly want to thank all of you who will be in our audience. And we hope that you saw this as an interactive seminar. It's always a little hard on Zoom. To prepare, I read the Blackwell sisters' book, and I just have 2 very quick quotes for you. One is Elizabeth Blackwell, who overcame huge obstacles, said, "I believe that women are the best helpers of one another." And that's what we tried to do for you tonight. And then what was interesting, she had such male aggression against her. And then a pastor from Brooklyn, who she didn't think would be supportive, came in her support, and he said, "Women may be better suited to medicine than men." So I thought that would make you all smile. So I want to thank everybody very much and turn over the vote of thanks, which is a Grenadian tradition, to our senior Grenadian physician here tonight with us, and that's Dr. Kecia Lowe.
Thank you, Dr. McGill. It is my pleasure to thank the SGU alumni team for organizing such a wonderful event. Dr. Brendan Lagrenade, Vice Provost, Ms. Tonya Duncan-Phillip, Associate Director of Alumni Communications, Dr. C.V. Rao, Dean of Alumni Affairs, Ms. Nisha Beckles, Assistant Administrator, Ms. Nicole Brown, Executive Secretary, Office of Alumni Affairs, as well as Dr. Kristen Hughes and Dr. Danielle Crow, who are committee members. I'd also like to thank especially our moderator, Dr. Francis McGill, Professor Emeritus, and to my esteemed colleagues for taking time from their busy schedules to participate in this illuminating panel. Dr. Maria Lenaz, Dr. Deborah Coy, Dr. Shania Flagg, Dr. Myanna Charles, and Dr. Sasha Lake. And of course, thanks to all of those of you who are watching this presentation.
Thank you all, and we'll sign off tonight, and we appreciate everybody's attendance, and we're wishing you a very wonderful Women's Physician Day. And please mentor women not only into medicine, but into the STEM careers and into anything that they would like to do that's good. All right, so thank you all very much.
Thank you, Fran.
Thank you, everyone.
Thank you, everyone.
Thank you, everyone. Happy Women's Day.
Thank you.
Happy Women's Physician Day.